Even before the coronavirus began overwhelming Tunisian hospitals, Abdel Wahab Maghribi was already fatigued and worn out. The youthful doctor is frustrated by a health system crippled by years of underinvestment and an economy that does not guarantee him a better future.
I'm trying to emigrate outside of Tunisia. Why? Because the general situation in Tunisia is not stable, economically, socially and politically. Currently, the country can pay salaries, but in 6 months, 1 year, we don't know.
Anger and frustration have been building among the North African country's health workers for a while. Last December, doctors went on strike after an interned surgeon was killed by a defective elevator in a rural hospital. And now many can't wait to leave.
I was offered a job in a Gulf country with a salary that is 10 times more than a salary in Tunisia. And the means in the field of health are developing strongly in the Gulf countries.
Tunisia's health ministry says the sector needs 3,000 medical and paramedical staff to cope with the coronavirus. Hundreds of young doctors have been leaving every year to find work in richer Gulf countries.
In 2018, we're already closing in on 60% of departures. By the end of 2020, nearly 80% of young graduates went abroad.
Many in the country are disenchanted by a political system they consider dysfunctional. Early this year, protests driven by anger over corruption and COVID restrictions hit the country's major cities.
Public authorities do with the means they have, and they don't have any. The health budget barely represents 6% of the GDP.
Tunisia's National Labour Union has warned that the country could lose up to 2,700 doctors by 2022.